Hello, and welcome to today's webinar, Conquering Insomnia. My name is Dr. Godot, and I am Preventive Care Specialist here at the Health Education Department at Beaver Medical Group. The Conquering Insomnia webinar is divided up into 6 sessions. Today we'll be going over session 1, Changing Your Thoughts About Sleep. Session 2 is learning how to establish sleep promoting habits. Session 3 is learning how to associate the bed with drowsiness and sleep. Session 4, we will learn how to manage our insomnia by managing our stress. And then session 5, we will learn many different lifestyle practices that we can do in order to improve our sleep. And then finally, we will look at developing some stress-reducing, sleep-enhancing attitudes and beliefs. Now, the agenda for today's session is understanding your own insomnia, learning a little bit about cognitive behavior therapy and how it's used to treat insomnia. We're going to discuss negative sleep thoughts and how they affect our insomnia. We're also going to look at core sleep and positive sleep thoughts and how they can improve our sleep. Now, what exactly is insomnia? For many of us who suffer from it, we are very aware of what it is, but some of us are not aware of what the true definition of insomnia is. Insomnia is defined as insufficient, inadequate, or poor quality sleep due to one or more of the following reasons: difficulty falling asleep, difficulty staying asleep during the night, waking too early in the morning, or feeling overtired in the morning. Now, insomnia is initially a common response to different factors. It could be stressful life events, such as the loss of a loved one, or retiring, or planning for a major event. Hospitalizations also can affect our ability to go to sleep. The side effects of many medications can affect the quality of our sleep, and then some of our health conditions. However, there are a subset of individuals that develop chronic insomnia, which lasts more than 1 month and will persist in the absence of these initial reasons. Chronic insomnia is defined as disrupted sleep that occurs at least 3 nights per week and lasts at least 3 months. Sleep onset insomnia is difficulty initiating sleep or the inability to fall asleep at the beginning of the night. The period of time in which we fall asleep at night becomes longer, which in and of itself actually builds anxiety and contributes to insomnia. Some common causes of sleep onset insomnia include a change in our lifestyle, temporary stressors, or behavioral patterns such as drinking coffee or caffeinated drinks right before going to bed, or a lack of exercise. Now, the second type of insomnia is sleep maintenance insomnia, and that is difficulty staying asleep. So the first one is difficulty falling asleep, and this one is difficulty staying asleep. Difficulty staying asleep often gives rise to worry over not getting enough sleep, and that vicious cycle develops in which the worry itself becomes the main source of insomnia. Waking too early and struggling to get back to sleep is very common among people who suffer from insomnia. Now, there is drug treatment that has been used to treat both types of insomnia, but it is no longer considered appropriate for chronic insomnia because medications don't treat the underlying causes of insomnia. Medication doesn't work in the long run and has many side effects, and typically the insomnia returns once the medications are terminated. So, the CBT, or Cognitive Behavioral Therapy for Insomnia, is a multi-component program which consists of cognitive therapy, sleep scheduling techniques, stimulus control techniques, relaxation training, and lifestyle practices. We will go over all of these different components throughout the 6 sessions. The goal is to change those factors that are presumed to sustain our chronic insomnia. This program was developed by Dr. Craig Jacobs based on his 30 years of research and practice at Harvard Medical School and the University of Massachusetts Memorial Medical Center. It involved over 10,000 patients suffering from insomnia. And what they found is using this approach that you're about to learn in the next 6 sessions, actually helped improve sleep in 70 to 80% of their patients. It's actually more effective than using sleeping pills and reduces or eliminates sleeping pills in 90% of the patients. So it's a very effective program. In clinical guidelines published in May 2016, the American College of Physicians recommended that all adult patients receive cognitive behavioral therapy for insomnia as the first treatment option for chronic insomnia because CBT-I, which is what you're going to be learning about today, puts people to sleep faster than sleeping pills, works as well or better than sleeping pills, and is the preferred treatment for chronic insomnia. Now, the biggest obstacle to successfully completing this program is failing to stick with it. When people do not stick with the 6 sessions or the 6-week in-person program, they find that they are not able to overcome their insomnia. Also, people do not complete all the required sessions. So it's so important that if you're choosing to look at this session, that you look at all 6 sessions so that you can get the complete benefit of the program. Additionally, many people stop practicing the techniques after having used them for a time. So sometimes we find that clients are doing well and their insomnia has actually disappeared and they're sleeping well, but then they stop using the techniques and their insomnia returns. So it's important that even after the program is over that you continue to use the techniques so that your insomnia does not return. I also recommend purchasing the book Say Goodnight to Insomnia by Dr. Jacobs. It is a great supplement to this class as far as going into more details with the different components of the program. The placebo effect. Now, many of you, I'm sure, have heard this, where prior to the 1900s, most medications that were prescribed were totally useless, but yet patients still improved. Today, there are newly developed medications that are scientifically evaluated by being compared to an inactive placebo pill. Study after study has shown that for virtually all health problems, about 1/3 of patients improve when given a placebo. So, if you are taking sleeping pills, you've already experienced the placebo effect because generally they lose their effectiveness after 6 weeks of regular use. If taking sleeping pills for a longer time than you are experiencing the placebo effect. Additionally, if you fall asleep in less than 20 minutes after taking a sleeping pill, it's the placebo effect. And no sleeping pills work that fast. So it's just the belief, the placebo effect is just the belief that the treatment will work actually has shown to be effective in clients. So the placebo effect is one of the best pieces of scientific evidence demonstrating that our thoughts can have a significant effect on our moods and our bodies. And by maximizing your belief in the techniques in the program, your sleep will improve. So, in most instances, the underlying cause of insomnia are our thoughts as well as our behaviors or certain habits that are often learned, but they can be unlearned. For example, we have certain attitudes and beliefs about sleep where we may have negative thoughts or we may feel like we suffered from it for so many years that there's no way that we can be cured of it or that we have to depend on our pills. We may have negative, stressful thoughts about insomnia. We may feel a loss of control over our sleep, that we will never be able to get the necessary hours of sleep that we need every evening. Inadequate exercise or exposure to sunlight, all of that affects our sleep. Sometimes going to bed too early or sleeping in too late, those are habits that affect our sleep. Trying to force sleep or control sleep rather than letting it occur naturally contributes to insomnia. I'll talk more in detail about that later. Additionally, lying awake in bed, frustrated or tense, also contributes to chronic insomnia. So our negative sleep thoughts, our attitudes, can have a profound adverse effect on our sleep. Some examples of negative sleep thoughts that some of us may have are, I didn't sleep awake last night. I have to get 8 hours of sleep. My insomnia is going to cause health problems, or my insomnia is going to cause me to die. I'm dreading bedtime. Why does sleep come so easily for everyone but me? I feel miserable because I didn't sleep well. How will I function today after such a horrible night of sleep? I just cannot sleep without a sleeping pill. Now, how do these negative sleep thoughts affect your sleep? Many of us have these negative sleep thoughts, and we may think, oh, it's no big deal. It doesn't affect my sleep. But it really does. And it is the foundation, it is the first step, is recognizing those thoughts in order for us to have better sleep. When we have negative sleep thoughts, or NSTs, they have a forceful effect of making you feel anxious or frustrated. And when you're having those feelings right before going to bed, it mobilizes the stress response. So instead of relaxing and going to sleep, instead it increases your heart rate, your blood pressure increases, your muscles begin to tense, your breathing rate increases, it speeds up your brain waves, which activates your brain's wakefulness system, and it weakens the sleep system. So the result, another night of insomnia. So negative thinking actually aggravates insomnia. It makes it worse. So if you are trying to overcome insomnia, the first thing we have to do is be aware of those negative thoughts, the approach that we have towards sleep, towards insomnia. So if you're thinking, your negative thinking can actually keep you awake, can it actually do the opposite and help you overcome insomnia? Yes, it can. Changing your negative thoughts about sleep is one of the most powerful techniques you will learn. The power to conquer your insomnia resides within you and your thoughts and your approach and the way you see sleep and the way you see the bed. So cognitive restructuring, which is the foundation of the CBT program, is changing your thoughts about sleep. We need to recognize and replace our negative sleep thoughts with more accurate, positive thoughts so that you will feel less frustrated and anxious about insomnia. The result, you will feel relaxed and you will sleep better. It's not denying that you have insomnia. It's not just ignoring the fact that, hey, I don't get a good night's sleep. But it's attempting to think about it in a less negative way, because continuing to approach insomnia in a way that is negative will only contribute to your insomnia and make it worse. So there are many myths that are out there that contribute to our insomnia and make it worse. Those myths also contribute to our negative sleep thoughts. And one of those myths and one of those negative sleep thoughts that many of us say that affect our sleep, I must get 8 hours of sleep in order to function properly. That is so false. Sleep needs actually vary from individual, from age to from younger to older adults. On average, 6 to 8 hours is recommended. Adults average just under 7.5 hours of nighttime sleep, and many individuals actually function well on less than that. So if you do not fall asleep during lectures or during sedentary activities, or if you don't need an alarm clock to wake you up, and you don't always sleep in on the weekends, you may actually be getting enough sleep and you may be trying to get more sleep than you actually need. So research suggests that for many people, the amount needed to maintain performance for even extended periods of time is or about 5.5 hours. And what we call that is that core sleep. That core sleep allows us to maintain performance because it contains 100% of deep sleep, which is the most important stage of sleep, and 50% of dream sleep, which is the second most important stage of sleep. So more than 5.5 hours of sleep is considered optional and optimal. This is mainly dream sleep and lighter sleep and can be reduced without major effects on performance. So what is this based on? The findings of core sleep come from research studies that have found that college students who were restricted to 5.5 hours of sleep for several months did not have any major effects on their performance. Physicians undergoing residency training who perform surgery and other demanding tasks while averaging between 5 to 6 hours of sleep for months at a time. So they were able still to function very well. They found that studies on alertness which does not decrease significantly unless less than 5.5 hours of sleep is obtained. Transatlantic solo yacht racers who slept 5.5 hours per day while performing in life and death circumstances for months at a time. So they were only able to receive or to get 5.5 hours of sleep, but yet they were able to function well. People with chronic insomnia, who usually average 5.5 hours of sleep and who do not demonstrate significant performance deficits compared to good sleepers. So the findings on core sleep were found from all these studies that found that people suffering from chronic insomnia, solo yacht racers, college students, and physicians, all who were averaging about 5.5 hours of sleep, were still able to function. They still were able to perform. Another negative sleep thought that contributes to our insomnia is when we wake up and we say, I didn't sleep a wink last night, which affects the rest of our day and our ability to fall asleep later on that evening. This is actually false. Poor sleepers often overestimate when they initially go to sleep, which is sleep onset latency, and wake time after sleep onset by 30 minutes, and underestimate total sleep time by 1 hour. They perceive light sleep, stage 1, as wakefulness. Time perception changes under unpleasant conditions, such as lying awake in bed. Sometimes it seems a lot longer. By telling yourself that you're getting more sleep than you think, at least 1 hour on average, you will actually reduce negative sleep thoughts and sleep better. Now, daytime functioning, many people are very concerned that how will they function after a poor night of sleep. Many studies have found that moderate sleep loss may not impair daytime performance, particularly in patients suffering from insomnia. Actually, a large number of studies have failed to find significant adverse effects on daytime performance after a poor night of sleep. The main effect of sleep loss is reduced alertness. Yet studies on insomnia subjects show that they are not sleepier during the day than good sleepers. Our daytime functioning is affected by many factors, not just our sleep. It could be affected by our stress, whether we're feeling lonely or the loss of someone, concerns about our finances, our health, medical problems, medications. All of these things can affect our daytime performance. The foods that we eat, lack of exercise, drinking alcohol, as I mentioned earlier, medications, exposure to sunlight, certain times of the year, or even hereditary factors. All of these outside of sleep can affect our daytime functioning. However, insomniacs attribute their impaired daytime functioning entirely to their lack of sleep, when it could be any of those factors that are listed above. Learning not to blame your insomnia for your assumed poor daytime performance will actually minimize negative sleep thoughts and help you to relax. So since insomnia does not have major effects on performance and alertness, what is the major effect of insomnia? Our mood. Insomnia or lack of sleep will affect our daytime mood, where we find that we might be cranky, or we might be irritable, and we might be fatigued. This means that in most cases, the worst thing that will happen as a result of a poor night of sleep is that your mood may suffer. So we really want to be careful of those negative thoughts that say, oh, my daytime functioning is going to be awful. I'm going to be this or that. No, that contributes to insomnia. Yes, your mood may be affected, but we can work on that. We can change that. The daytime effect of insomnia on mood is due to two factors: the amount and the quality of the sleep that you have received. Negative sleep thoughts in reaction to sleep loss, such as I'm going to feel miserable today, which create a negative placebo effect for the day. Because if you feel it, if you believe it like we discussed earlier, then that will be the case as you go throughout the day. Those negative thoughts for the day will affect the quality and the amount of sleep you get that night. So sleep loss due to pleasurable or desirable circumstances such as parties or late night socializing or vacation is not appraised as stressful, and therefore it doesn't cause impaired daytime mood. So the first step is to become aware of your negative sleep thoughts, which is not easy because most times they are just automatic. So to maximize improvement in your sleep, we must first learn to consistently recognize and replace negative sleep thoughts with more accurate positive sleep thoughts about sleep. And you will need to write them down because a lot of times, like I stated, we don't always even recognize or realize that we're engaging in negative sleep thoughts. So the best thing we can do is write down those negative sleep thoughts so that we can be aware of them and so that we can design more positive sleep thoughts. Now, positive sleep thoughts, here are some examples of some ones that we can use. My performance will not suffer significantly if I get my core sleep. I'm actually probably getting more sleep than I think. My daytime functioning is not affected only by my sleep. There are other factors that will affect my daytime functioning. Since I have survived nights of insomnia before, I know I can do it again. And if I didn't sleep well last night, I am more likely to sleep well tonight due to a biological pressure to recover my core sleep. My daytime malfunctioning is due in part to my negative sleep thoughts. So if I change my negative sleep thoughts, I can have better sleep. So the goal of this session was changing our negative thoughts about sleep. This is our foundation, and it's so important for us to change our negative thoughts about sleep right before bedtime, during the night, and also when we wake up in the morning. Replacing negative sleep thoughts with more positive sleep thoughts is a foundation of cognitive behavioral therapy for insomnia. And it's so important that before we go on to session 2, that we master this technique, that we continue to work on it, but as well as master it and improve our negative thoughts about sleep. So in next session, we will learn some actual sleep scheduling techniques. And what we'll do is learn how to create a positive association between the bed and sleep. And for those of us who are using medications, we will also learn some sleep medication tapering techniques. Thank you for participating in today's online course. I hope you enjoyed this presentation. There are 6 sessions total. In order to get the complete benefit of the CBT-I program, it is important that you attend and listen to all sessions. If you have any questions about any of the ideas that were presented in today's presentation, please feel free to contact me here at Health Education. The number here is 909-335-4131, or you can email me at the email address listed. You may also contact Vanessa Schmidt at the same number if you would like more information about additional online courses that are offered through the Health Education program. Thank you and have a great day.